Welcome to Caregiving Club On Air. This podcast is dedicated to the millions of family caregivers who want wellness tips and self-care solutions, who seek expert advice, and who want news about healthy aging and how to create well home design in our forever homes. I'm Sherri Snelling, a corporate gerontologist, author, and educator, a TV interviewer, host, and news commentator. I'm joining you from Southern California, where our interviews and news take us all across the country to explore the many ways to help you on your caregiving journey and to lift you up here at Caregiving Club On Air. Welcome to Caregiving Club On Air and our May episode, where we're going to be focused on Older Americans Month, National Mental Health Month, Mother's Day, as well as National Moving and Home Improvement Month and National Day of Prayer, which is on May 2nd. I am your host, Sherri Snelling, and we have got a jam-packed episode for you. We're going to be talking to our friend, Kian Saneii, who is the founder and CEO of Independa. He's going to be telling us about age tech solutions to help our older loved ones live safely and more comfortably at home, but also what is happening in the area of telehealth. We're also going to be focused on anxiety for National Mental Health Month and what are the things that we can do to address anxiety. We're also going to talk about optimists. Optimists actually live longer than pessimists. And of course, since this is Older Americans Month, we're going to be focused on centenarians living to 100, which many of us have the possibility of doing. But we're also going to talk about the other side of living longer, which is ageism. And there is a lot of ageism that's left in our workplaces and society in general. We're going to touch upon that. And what are the things that we should know about ageism so we can avoid that last ism that we're not taking care of? Of course, as I mentioned in Well Home Design News, we're going to turn to National Home Improvement Month as well as National Moving Month, two very important issues that a lot of family caregivers get involved with their older loved ones, whether they're downsizing and moving them into a new community or whether they are improving their health so they can stay there and live more safely and independently. Then, of course, we're going to end with our Me Time Monday Wellness Hack, which, as I mentioned, is going to be for National Day of Prayer, which is our spiritual wellness. How do we build our spiritual wellness, which is from my book, Me Time Monday. It's one of the 7 areas or 7 elements of wellness. So we'll end the episode with that. So let's go ahead and dive right into our Caregiver Wellness News. So I have a lot to share with you in Caregiver Wellness News today. I'm going to try to get through this as quickly as possible so we can get to that wonderful interview that we have with Kian. But I wanted to start first with May Mental Health Awareness Month. And as we all know, anxiety is certainly something that we feel when we are burned out, overwhelmed, stressed. In fact, anxiety is really anticipatory stress. It's where we're projecting into the future things that may or may not happen and becoming very stressed out about it. And it's what we call anticipatory stress in gerontology. So I wanted to just read you this list because I thought it was so interesting. And I think, again, in the research for my book, there are so many external factors that create our anxiety. And part of it is fear. That's a big part of why we feel anxiety. And what I talk about in the book is how do you take the external locus of control, the external factors that are creating this anxiety, and turn it around and take the control back. And that's what we call the internal or inner locus of control. So let me first read you this list because this came from the Anxiety Center in the UK. And, we know that 1 in 5 Americans have some type of mental health issue. And I think it's also 1 in 5 that have anxiety disorders. So in that population of people who are suffering from some type of mental health issue. So this is the list of reasons that the Anxiety Center gives for why we might be feeling this anticipatory stress. First of all, pressure from social media. Okay, you guys have heard me talk time and time again about how, the promise of social media to connect us and unite us and bring us together and create these conversations All sounds wonderful, but the real downside is that it's really increased a lot of the stress that we have in our lives. And so that is one of the number one things that the Anxiety Center lists is that um, people who are comparing themselves to others online, people who are feeling like they just don't measure up, other people are happier, other people are more successful, other people are prettier, or whatever it happens to be. We're doing this constantly, and it's really dragging us down. And so there's, a lot of solutions that I'm going to talk about and also that are in my book, but mostly it's really doing that digital detox. It's getting away from all that messaging, which is really self-defeating. It's really making us feel less less good about ourselves. So that's kind of number one. The second is, of course, the pressure from society to achieve more. There's a lot of challenges out there today. We're faced with a lot of economic woes and other issues that are just day to day struggles. And then on top of that, again, we're comparing ourselves to maybe our peers or colleagues and saying, well, why did that person get promoted? Or, why couldn't I get that job? Why did they choose that person? Or whatever it happens to be. So there's a lot of that goes on as well. Um, so this thought about instant gratification, it's interesting because instant gratification, which is actually something that's related to one of our four feel-good hormones, which is the dopamine hormone that we have. Now, dopamine can be both good and bad, right? Dopamine is our reward hormone. It's also the hormone that helps us kind of learn from our experiences, but it can also take us down the wrong path. And so instant gratification is if we don't hear from somebody immediately when we send a text or, whatever it is. I mean, all this technology has made us feel like we have to be 24/7, instantly vigilant, instantly accessible, and that's just not realistic. People, again, need time to get away, do the digital detox, get out into nature, socialize with others, and be in real life instead of URL. We're IRL, right? In real life. Those things are really critical, and again, these are all things that are exacerbating this feeling of anxiety. And I think that caregivers can really relate to that because when you become a caregiver, you do feel like you're on constant alert 24/7. You're waiting, you're anticipating that call from mom or dad. They've fallen or they don't feel good or they need to call 911 or something happened or whatever it is. And so there's a lot of this that happens with family caregivers just outside of our general life of anxiety. And we have to be mindful of that. And while we definitely want to be on call and available, we also have to be realistic about, dropping everything every 5 minutes or anticipating dropping everything every 5 minutes. It may not even happen, but we're thinking it's going to happen. And so we're in this constant, like, ooh, we're all stressed and all that stress is creating, releasing cortisol in your system and increasing your inflammation. And we know that those things are bad. Those are leading to different illnesses and back pain and headaches and all kinds of, ailments that we may have. A lack of community involvement. Again, we want to go back to being in real life with people and socializing, getting that oxytocin hormone, another one of our four feel good hormones, but you really only get that when you are near others. You're looking into their eyes, you're shaking their hand, maybe giving them a hug, you're collaborating, doing things together. It's really, really critical that we don't live our lives online or just digitally. Um, Also, the breakdown of the family unit. I thought that was a really important one. And I'm going to talk a little bit about family when we get to our Well Home Design News. I've got a little HGTV commercial for you. But, family is so critical. And very often we see a lot of messaging out there and we see a lot of news reports that are showing that, families are really struggling. The generations are not talking to each other. They're not sharing. They're not feeling supported. So the breakdown of family unit really has a big role to play in how we're feeling more anxious. And then of course, just general lack of contact with the outside world. That's again going back, digital detox, got to get it every day. Get away from your smartphone and the texts and the chimes and the emails and streaming and just sitting there kind of like a zombie watching, show after show. Get outside, breathe fresh air, all that kind of stuff. That nature is what really refreshes our brain health and helps us overcome these feelings of anxiety. Also in my book, I'm not going to go into it, but you may want to check out, I have a whole section on how to break the anxiety code. There's some great research and science there on concepts from psychologist Claire Weeks, who talked about floating. The floating exercise is wonderful. And later in this episode for Me Time Monday, at the end of the episode, we're going to do a spiritual wellness hack, but it also helps with anxiety, and that is labyrinth walking. If you haven't tried that, it's really interesting. If you want to stay tuned for that Me Time Monday wellness hack and find out a little bit more about that. I can just tell you that, what I felt stressed recently, just FYI, for anybody who follows me on Facebook, I'm just going to tell you right now, my Facebook account got hacked. Don't know how, for Caregiving Club. Somebody took it over. They're posting really weird animated stuff. I'm trying to get Facebook to help me figure this out. But look at how, again, technology was supposed to help, right? Get messaging out about what I'm doing with Caregiving Club. And instead, it's created all this stress in my life because I can't fix this thing. So we just have to understand sometimes we just got to pull the plug on the technology, step away for a little bit and not worry about it. So if you go to my Facebook page, just know it's not me. And then if you have a serious mental health issue, depression, suicidal ideation, again, I just want to do a call out that there's a national hotline now to help you. It's 988. Don't hesitate to call and get somebody who is compassionate on the line who can talk to you and help you work through the feelings and emotions that you're having. Now, I mentioned earlier that optimists actually live longer than pessimists, which has been now proven through several, numerous scientific reports and studies that have been done. And I talk a little bit about optimism versus pessimism in my book. Now, a lot of people think that our personalities are fixed. We either are a glass half full or glass half empty type of person as we, kind of become adults and form, our thoughts and values systems and all that. And on the one hand, Aristotle, for instance, thought that personalities were fixed. So did William James, who was a noted psychologist in the late 1800s, early 1900s, known as the father of psychology. And some of that might be true. However, there's kind of a new school of thought, and it's that it's not so much our personality, but it's more the traits, the personality traits that we have. And some of that can be altered a little bit. We can learn to be a little bit more optimistic. We can embrace more positive thinking. A lot of the cognitive behavioral therapy that's out there, CBT, that is done actually addresses that, helps people get past some negative feelings, some toxic feelings, get to a more positive outlook on life. But I just wanted to share some of the information from you. I call it in my book too, are you an Eeyore or a Tigger? If you remember the Winnie the Pooh series, Tigger was the bouncing tiger. He was happy all the time, although he had a little bit of trouble. You can definitely be an optimist and still maybe have to curve it, pull it back just a little bit. But Eeyore, of course, was the one, he was the gray donkey that everything was always sad, nothing was good. There was no good outlook or whatever. The thing that was different about optimists and pessimists is that they both see the world has challenges, has things that maybe we can't control, but optimists will see those types of issues as transitory. They will say, okay, it's not good today, but I know it's not going to last forever, or if I do this, I can get past it, or this will help, or whatever. Whereas pessimists are just down for the count. Something happens in their life, there's a challenge, or there's an issue, and it's fatal. It's, there is no solution to this, and it's all bad, and the world's going to end kind of feeling. And we really want to help get people past that, because in any circumstance, no matter how tough, and a lot of this does have to do with sometimes our spiritual wellness, there are ways through. And they're not easy, and we're not saying it's going to be great, but there are ways through. And so just having that hope is what becomes really, really important for all of us, really. And so you can still be a pessimist in your personality, but you can also learn how to embrace hope in order to help you cope. Hope to cope. So anyway, there was a study that was done. I just wanted to share this with you as a statistic. It was done among older adults ages 50 to 79, and it found that the 5% of the optimists live longer. It's not a huge number, but it's good enough. And actually, they had a 10% more likely chance to live past 90, and they lowered their risk for heart attacks. So there you go. Lots of good reasons for us to embrace some hopeful messaging, positive psychology, all those kinds of things. I also just want to do a quick shout out before I move on to Older Americans Month, because I want to also recognize Memorial Day. We've done Memorial Day episodes in the past. And you can go back to season 2, where we did one with Sean Perry, which was really great. But, our fallen heroes are so important to us. My stepdad was a wonderful veteran of the Navy. And there's something kind of fun that we do here locally that my mom got us all into. But on Memorial Day, there is a celebration of our fallen vets. And there's a ridge up above Balboa Bay, where I live in Southern California. And it's really beautiful. And you can see the whole bay and the coastline and all of that. And what they do is they plant 1,776 flags for local veterans, and you can purchase the flags. So my mom purchases every year for my stepdad, and what they do is they put the flag up, and then they attach the photo of your loved one with their bio, their story of their military experience, and what they did when they were in the military. It's just a really beautiful reminder, I think, of how our veterans, both the ones that are living as well as the ones that have fallen, our fallen heroes, have really provided us this wonderful opportunity to live in freedom, live in liberty, pursue happiness. We owe it to them to try to be happy every day, because that is part of our Constitution, or I should say part of the Declaration of Independence, really is what it was. And so it's important for us to think about those folks and what they've given us. It's a great gift, and I just want to do a shout out to my stepdad, who was a very proud Navy man, and his flag will be up there for the flag. It's the flag of heroes, I think is what it's called. Flags of honor. Sorry, flags of honor is what they do here locally. And hopefully they do some things local in your community as well. Check it out. It's just a wonderful kind of it's a wonderful thing to do to honor our veterans. Now, let's move into May, Older Americans Month. Okay, so if you may not know this, Older Americans Month is an official month that is signed every year by the president. He authorizes Older Americans Month. Under Older Americans Month, there are also some benefits for family caregivers. So, for instance, there is the National Family Caregiver Support Program, and this was formed in 2000. It is administered by the U.S. government Administration on Community Living, which we call ACL in gerontology in the aging space. We have our acronym for that. And they get funding under the Older Americans Act for that National Caregiver Support Program. So what does it do? It gives you great resources. It gives you even counseling. It also connects you to respite services where you can get a break while you're caring for your loved one. So it's worth checking out, because a lot of these things you can tap into for free, and the information is really good. So check that out, because that is part of Older Americans Month. Now, it's really funny because I talk about wellness, of course, in my new book, Me Time Monday. And one of the themes in the book is how wellness has been hijacked by kind of consumerism and marketing, right? Everything is wellness these days. We got wellness tuna fish, wellness resorts, wellness pillows, wellness juice, you name it. Wellness is everywhere. But also, we've had messaging in wellness, because now they're associated, of anti-aging. And I have always kind of laughed about the anti-aging products out there, particularly I think for women and the beauty products, because anti-aging really means what? It means death. Because if you're not aging, you're dead. So I think they figured this out a few years ago. Now they have pro-aging. It's not anti-aging, it's pro-aging. But what does pro-aging mean? Right. We don't want to promote the aging process, right? So it's kind of funny. I think the marketeers are still trying to figure out the language around all of these products and everything. But I always think about the beautiful actress Audrey Hepburn, who was one of my icons. And she aged so gracefully. You know, she never had any cosmetic surgery. As far as we know, she didn't do Botox or any of that stuff. And this was a quote that I found from her from American Photo Magazine. They asked her if they could airbrush her photo. This was later in life when she was doing a lot of work for UNICEF. And so they said, you know, can we airbrush it? And I'm sure they wanted to take some of the wrinkles out and all that. And she replied, told them not to mess with my face. I've earned every one of those wrinkles. And I thought, what a wonderful statement from such a beautiful woman who really did age gracefully. I mean, she looked as gorgeous at the end of life as she did when she was in her 20s when she started to make movies. But, you know, it's a fear of getting older. And I think we need to flip the script on this and think about getting older as more about you become wiser. Now, whether you use that wisdom or not is a question mark, because older people aren't always wise, but you do have a lot of experience under your belt. You've seen a lot of things. You become more patient. You become more empathetic, I think, because again, you've kind of been through the wars. You know what it's like, through this life journey. And also there's a sense of, hopefully for many of us, there's a sense of satisfaction and accomplishment. You know, I mean, that is what boosts our spirit. That's what makes you happier, to feel like you've mastered something or you've accomplished something really great. You're going to leave something as your legacy on this planet that you feel really proud about. Could be your children, could be a garden, could be the community volunteer work you do, whatever it is. We have to celebrate our older selves. So I just wanted to read off a few things for you that kind of fit into this category of older Americans. So and also centenarians, which are the people that make it to 100. So as you probably know, the Blue Zones, very famous books over the last 20 years. Dan Buettner went around the world looking for pockets of areas where people live to 100 or beyond and wondering what are their secrets. A lot of it was based on a Mediterranean diet, but it was also based on multi-generational, intergenerational connections and community. Very important to have that social health mirror and match our physical health, right? And so there was a Netflix series that came out a few months ago called Live to 100 Secrets of the Blue Zones. You may want to check that out. So in my book, I tell stories for every chapter. The financial wellness chapter has a story about Jeanne Calment, who was a French woman who is still the oldest person on record in terms of the Guinness Book of World Records. She lived to 122. You may want to check that out. I'm not going to tell you the story here because I would love you to buy the book, but it's a fun story about how, wow, we just really don't realize how long we might live. And certainly for Jeanne, it worked out very well for her. Also, Iris Apfel, just a shout out to Iris. We lost her just a couple months ago, March 1st. If you don't know who she is that wonderful silver-haired, foxy woman, short hair with big crazy glasses, who in her 90s started showing up in TV commercials for Kate Spade and Target and H&M and car commercials and all kinds of stuff. She just became this wonderful icon. She had been in the fashion world forever. Anyway, we lost her a couple months ago, but she lived to 102. Also, Vogue featured just a couple years ago. Vogue featured their first 100-year-old model, Bo Gilbert. So big shout out to her. We're going to have a link to a video interview with her when she did that Vogue fashion shoot, which is wonderful. I recently spoke at a conference for long-term care insurance agents about how to really understand aging older adults, family caregivers, how to work with them, how to connect with them better. And I talked about ageism. Now, I mentioned ageism earlier. Ageism is where we are discriminatory against older people. They shouldn't be doing this, or they can't, they're not capable, or whatever. I wasn't really happy with Nikki Haley, and I don't like to talk politics on this podcast, but she had called for cognitive tests for anyone over 75. Actually, the cognitive test should be done for anyone over 29, because that's the point where our brains are now fully formed and our brains start to decline. So if we don't stay in the game, and we don't do brain health exercises, and we don't connect socially, and we don't keep working and all those things, then our brains will decline. So it isn't really age related or number related. And I think that was a good example for me of ageism, because just because you're 75 does not mean that you're on this decline. I've seen people who are 100 who are super sharp. But you think about, we are starting to, I think, honor older Americans now. The Golden Bachelor they had a huge audience. Martha Stewart, 82, on the cover of Sports Illustrated swimsuit issue. The reboot of Sex and the City, and Just Like That, and all the actresses are certainly a lot older than they were back in their heyday. Rolling Stones is on tour again this year with 80-year-old Mick Jagger and company. So there are a lot of examples of how we can still be great and sexy and thriving after, what some people think is like the decline starts at 60. I certainly hope not. But I just wanted to let you know, because I work with a lot of employers. I know sometimes we get a lot of HR folks who are listening to this podcast. I do an ageism workshop now for both the C-suite as well as middle management and HR departments. And it's all about how to understand aging better. What are the stereotypes? What are the things that we need to be cognizant of in the workplace to not discriminate against older workers and older adults, family caregivers who are caring maybe for older adults and feel like they have to stay in the shadows. There's still a bit of a stigma maybe of coming out and saying, yes, I need more time to do this because I'm taking care of my older mom or dad or grandparent or whatever it happens to be. I'm also going to share with you on our episode guide page, I had been involved when I worked at a very, very large health insurer a few years back. I was in charge of something called the 100 at 100 survey. I loved that project. It was going out and interviewing centenarians around the country, and it was fascinating. And I think the secret to the centenarians that I learned is just go with the flow. You know what? Don't sweat the small stuff. Stay optimistic, stay engaged in the world, but just let it go. So I think that's a great lesson for all of us, right? Then go back to anxiety. Just don't anticipate what could go wrong. Just enjoy the day today. So I just want to, because it's Mother's Day, I want to do a shout out to all the moms out there, especially my mom, who of course is the best mom on the planet. But happy Mother's Day. Many of us will be taking care of our older moms, because women do live on average about 3 to sometimes 4 or 5 years longer than men, than our dads. We also know that almost half, about 47% of women over the age of 75 are living alone. And that, again, creates a situation where we want to take care of our moms and help them live at home independently, but also not be socially isolated or lonely or whatever that is. And 22 million older adults live alone, and 30% of those 22 million have no children or other family support as they age. This is what we call solo agers, okay? So the solo agers are the ones who, we think about a lot in terms of technology and some of the age tech innovation and solutions that are out there, but also some of the social activity, the transportation. How do we make sure that solo agers, again, don't feel socially isolated? We know loneliness can have a huge health effect. The U.S. Surgeon General said 1 in 2 American adults are lonely, and some of those might be those solo agers. So a lot of great age tech solutions out there. We're going to probably have some of these folks on a future episode, so I won't go too much into detail, but shout out to LEQ, which is a cute little robot now in its 3rd iteration, but it's a companion for solo agers who are living at home. But it also uses artificial intelligence, so machine learning, to really understand that older adult and start to personalize the information and the interactions that it's having with your older adult, which is really interesting. The GrandPad, which I had launched years ago with a wonderful tablet for older adults that came all of the apps and things were pre-loaded onto it, really easy to use. They've now launched something called Grandy, which uses AI for virtual companionship. And then, as I promised, Independa. Now, Independa has been a leader in age tech solutions. And what's really interesting is Independa did not come up with a new device, not a new tablet or a wearable or a robot. They just used the television, which is, right, we're all watching TV. Now, I know younger generations are probably watching shows on their watch, right? You're watching stuff on your mobile device. But for people who are older, the TV is still kind of our anchor. And so Independa, formed a relationship with LG TV. And it's just fascinating what they've been able to do, what they've been able to build into that TV. Also, with the rise in telehealth that we saw in telemedicine during the pandemic, it became even more important to be able to deliver some of these services, these telehealth services, into the home in an easy way for older adults, that they don't have to download an app and figure out passwords and all those kinds of things. So with that, I have our good friend Kian Saneii, who is the founder and CEO of Independa. He's going to tell us about all of these things and more, and how to keep our loved ones safe but also socially engaged while they are living at home. So this is going to be a really fun discussion because Kian Saneii of Independa has been a great friend for many years, and I am a huge fan of everything that he's building and what he's been doing. And he's here to talk to us today about an annual survey that Independa does on telehealth, but also tell us a little bit more about what Independa is and how it is really helping older adults flourish, and also helping family caregivers to take care of their older loved ones. So, Kian, welcome to Caregiving Club On Air.
Sherri, it's so nice to be with you. As you mentioned, we're long friends, and it's been a while since I saw your wonderful face, and it's so exciting to be with you here today.
Yeah, well, it's great to at least be doing this virtually. So, I wanted to start first of all with where are we talking to you from today?
I am in Encino, California, which is a part of Los Angeles.
Wonderful. So beautiful, sunny Southern California. I've been watching some of the news with the 20 below weather, and I have to say, it's hard to beat California weather, right?
It's cold for us here even, but I know it's crazy cold elsewhere, so no complaints.
Yeah, no complaints at all. So before we dig into the findings from your recent annual survey, Kian, I wanted to have you explain to our audience a little bit about Independa and what you've built and how that supports older adults and family caregivers.
Sure, you bet. We're this April a 15-year-old company that's dedicated to the vision of having any one of us live in the residence of our choice, whether in our home or in a community, longer, safer, more comfortably, and allowing that individual to delay or even eliminate the next episode or stage of care. So that's really what Independa does. Now, practically, we're a software platform that leverages the TV, but also other areas, which might be news to you, Sherri. We, as of this week, are running on our own website, so you can actually go on independa.com and pick up the Independa Health Hub as a platform to serve your needs. We're also on Zebra tablets, and also coming up on other TV platforms and other environments like a cable or satellite environment. So we're pretty agnostic on how we get into the home, but it's really all about how simply someone can use our platform for health and wellness.
Well, and I love that you're expanding. I know as you mentioned, when you first started, it was through the TV and working with LG TV in partnership with that. So it's nice to see that you are growing. But I think that ease of access to a television and, older adults who are so familiar with getting their news and entertainment and everything through the TV was really kind of brilliant when you brought this out. It wasn't a new device, that somebody had to learn how to use or connect to the internet or all those things. You kind of just made it really easy for older adults.
Exactly. And we serve a wide range of the marketplace, from senior living, which, as you know, has lots of subsections between assisted living, independent living, even memory care, short-term rehab, et cetera, nursing homes, and also the home care, home health environment, which is its own, specific market, and all the way to the consumer. So today, if you buy an LG TV and soon Sony TV, Independa will be embedded inside. And what that means is you don't have to have another appliance, another cost, another installation. And that's a consumer environment where the caregiver, the daughter, the son, the friend can just download a mobile app and be connected to mom on this very large, familiar, comfortable screen in a different way than is on a computer or a tablet or a small smartphone.
And again, I know we're going to get to the survey, but one last question that I think is really important for our audience to understand is that, when you launched, I know that you made it really easy and accessible for older adults, for instance, to go onto Facebook or create a Facebook page, get medication reminders that would pop up on the TV, be able to access certain things, and you've grown that tremendously. I know that you had some big announcements at CES, I think either last year or a couple of years ago, where you're making partnerships with some content providers. Tell us a little bit now about the breadth of things that people can access now through Independa.
Sure. The big new additional pillar of value that we provide is called the Independa Health Hub. And that's really what's embedded inside LG TVs. And when I say embedded, we're actually integrated at the operating system level in WebOS, which is really unique. So you could be watching Netflix or satellite, content or local channels, whatever, it doesn't matter. And you get a reminder for something, or you get a pop-up that says it's your doctor calling, or it's your daughter calling, or you just got a photo. So we turn this digital appliance into a bi-directional gateway for health and wellness. So the Independa Health Hub, like you mentioned, has a number of our wonderful partners offering their services. For instance, WebMD has 800 videos in 16 categories that you cannot get anywhere else as a consumer. So these are medical grade content that you could do searches on subcategories and learn about your issues maybe before an operation, after an operation, managing chronic conditions for a friend, etc. We have a great partnership with Lucid Hearing. You have a free assessment for your hearing. And if you need a hearing aid, then they can actually sell it to you right there on the TV. Now we can do that over the counter. The world's first TV that allowed that to happen. We also have a great partnership with Capital RX, which is a pharmacy discount card. So it's free. You get great discounts up to 90% of your prescriptions. And the list goes on. Our friends at Spiral 100 have their exercise videos, Cora Health with their faith-based videos, Senior Savvy with their tech education videos. We have SurvivorNet, which is fantastic content for cancer survivors and chronic condition management, free. Senior Savvy is free. I'm missing a couple things. A bunch of free games. Let's see what else. In-home lab tests, so you don't have to go necessarily to LabCorp or Quest. Maybe it's snowing, maybe it's cold, maybe you don't feel like driving, maybe it's a few hours away. And so it's all about how do I stay healthy and independent in my own home. And just as a interest point, we give so many of these services away for free. So you can get video chat, you can get little Billy's soccer game clip where he scores, delivered right on your TV from your daughter's phone. You can get audio messages, photos. What am I missing? I mentioned the games. And all of this for free, and we don't sell the content. So we don't sell or rent your information, so it's truly free. And then whatever you need, very importantly, I knew I was missing a big part, televisits. So 24 access to doctors, 50 states, therapists, and also dentists. So really, we're going out of our way to make sure you have the services that you need curated and delivered in one platform.
Well, and again, I think it's so great for older adults because, there's a little bit of a hesitancy, a little bit of a hurdle there to learn something new on a new device or a new app. So having it kind of delivered through the TV, making it really easy and accessible. And then again, just before we dig into the survey, tell us again what the cost is. So is there a monthly subscription then to the Independa service, or how does it work to get all of this wonderful content and everything you're providing?
Sure. If you're senior living in home health, home care, there's a subscription as an enterprise application for us. And then that way you get to manage all the members, participants, clients, patients, whatever. So that's different. On the Health Hub, as you get it on the TV, many of the services I mentioned are free. The other ones, for instance, a doctor visit is $55 per visit. Therapist is $55 per visit. Dentist is $75. All of the content I mentioned for WebMD is $17.99 for the entire year. So it comes to hardly, it used to be cost of 3 or 4
That's a
cups.
good deal.
It's a coffee. Yeah, all these videos and the lab tests that come to the home depends on the test. Otherwise, what am I missing? The Spiral 100 exercise videos are $4.99 a month, so that's a subscription. Coro Health is also $4.99 a month. And pretty much everything else is free, other than, if you need to get a hearing aid, it's the cost of the hearing aid. And there's a budget, there's a recommended, and there's sort of the premium versions that are offered.
It's certainly affordable in today's world of looking at all this streaming services and subscriptions that we're asked to buy now. It just seems like everything just keeps piling on top of each other. So let's get into the survey. For this is, I think, the 4th year that you've done this really wonderful survey on telehealth. And I want to have you explain a little bit, you touched on it, that you have doctor visits that can be done virtually, but tell us a little bit about telehealth. I know that it grew exponentially during the pandemic because it really became a necessity, but now it's really kind of taken hold. And I think there's a lot of conveniences both for older adults and family caregivers. So tell us a little bit about telehealth in general and how it's grown, but then let's get into the survey results that you found about how it's growing.
Sure. Telehealth in general, as you know, Sherri, so well, was in many ways sort of waiting to happen. A lot of the challenges were around how the doctors were getting paid. So the technology was ready, but the payment systems weren't ready. And because of COVID, there was a lot of changes in some of the HIPAA requirements, some of the CMS requirements, and some of the FDA requirements around HIPAA. So all those kind of combined to allow people to get paid. And once that happened, so to speak, the cat's out of the bag, and the convenience has really become so prevalent that everyone is, I shouldn't say everyone, in some cases you have to go in, but in so many other cases, people are interested in being able to have the convenience of talking to a doctor from the comfort of their home. I'll also mention that it turns out the TV is the digital health device in the home. We're talking about, is it the scale? Is it the pedometer? Is it, the blood pressure cuff? But it turns out that TV allows you to have so many different features in it. And particularly for telehealth, when you think about it, the doctors tell us that, especially for the demographic that we serve, it's so much more convenient. You get to see the entire body, so you see the body language, not just the face and the nose. You get to ask someone to get up, maybe walk and bend and move, and still have them in the frame. In the case of therapy, for instance, family therapy, you get to see the body languages of 2 people versus taking turns, handing a tablet to each other. And for macular degeneration, just the convenience of sitting on a couch and seeing this big screen. So we're really excited for delivering sort of better telehealth. It could be the same doctor, the same plan, but on the TV, it's a much better experience and more effective experience.
Absolutely. Well, and you touched upon a couple of things. I want to just grab my notes because from your survey, what I was really fascinated by is that you found that 65% of in-person doctor visits require 2 to 3 hours, which makes a lot of sense. I mean, I'm thinking 2 to 3 hours seems short. Just the travel to get there and then the waiting room situation and, travel to get back and all of those kinds of things really add up. And yet telehealth is 72% of telehealth visits require just 30 minutes. So you're thinking about the precious time, not just for the patient, but also for the family caregiver, right?
That's a great point, and that's exactly what I was going to raise. As contrasting that these 2 numbers are and compelling that they don't even highlight what you just said, which is, what if you need a second person? What if now it's 65%, 2 to 3 hours, plus someone else is driving you, plus someone else needs 2 to 3 hours, maybe from work, and maybe they need to travel quite a bit to get to you to then take you there. And so the fact that you can do it from the convenience of your home, but also for the other person, the caregiver, the daughter, the son, it's so much more convenient for them as well. So it's it's much more compelling even than those numbers.
Well, and again, I know that when I was working at an academic medical center, USC in Southern California, and I think you and I actually talked, I was involved in a research project which we were using Lyft to give free rides to get patients to come back to their follow-up appointments because we noticed that so many of them didn't have access to rides. Maybe their family caregiver was working and they couldn't make the appointment. It's hard to get some of the paratransit because it is like Super Shuttle. It's like you're going to be in a shuttle car with four other people, maybe two of them are coughing, and you have, an immunosuppressed system, so there's all these issues with the transportation, and this really takes that whole dilemma out of it.
Exactly. Exactly. And that's just generally the broad brush of telehealth and the benefits of that. And then, like I said, you apply it to this TV screen, it becomes that much more convenient because there's challenges around, let's say, if it's on a tablet or a computer, the doctors tell us, well, it's really not as easy because somebody, if you ask them to move or to get up and show you something or to walk and do this and do that, it's so much harder to coordinate that. So the market has really come to not just telehealth, but the fact that there's this device in the home that everyone is comfortable with, and it has this big screen, and why not use it to see a much better view of the patient in the case of the televisit?
Sure. Were there any other statistics or any other things that surprised you in the survey that you did this year, or things that really changed significantly from other surveys that you've done in the past?
Yeah, there was a few actually this go around. The 98% that says 98% had the same or improved doctor relationship through telehealth. That is a contrast to the past. I think in the past, people felt like telehealth was sort of a poor man's version of a visit, and or I should say, poor person's version of a televisit, and that you're sort of missing out on some things. But now, predominantly, everyone feels like it's just more convenient. And if it's appropriate for the type of discussion that's about to be had, then why not do it with convenience? And they feel like it's the same, and you're not losing out with the relationship with the doctor. The other thing that was very surprising to me was the comfort of the respondents with AI. As we all know, AI is kind of right in the hype cycle right now, and maybe it was because of that, but 97% said that they would approve AI to diagnose their health issues. And I'm not sure I'm as comfortable as what the survey respondents were, but that's also a good sign.
Yeah, I think well, and I think, yes, the AI certainly has, a lot of momentum behind it, and, people are worried about, well, what is that gonna mean? Is that gonna, completely separate us from human interactions? I hope that it does what you just said, which is it allows this machine learning to better understand what's going on with somebody by aggregating all this valuable data and then really being able to personalize it much more than we can today, but not getting rid of that kind of high touch, ultimately in-person interactions that sometimes we do still need. So it's kind of this perfect blend. Telehealth, I think, is a perfect blend of, hey, if you just have your annual wellness visit or, got a cough or something, you could do this telehealth. It's so convenient. If you have other things where you really feel like you want to go in and you really want to look in the doctor's eyes and, talk to them, you've got that opportunity too. So it's got, you've got great choices now.
Exactly. And we all hear, and hopefully not too many of us this applies to directly, but we all are aware that societally it does apply quite a bit, that we have great inequities in health. And so
Yeah.
where do those inequities come? They come in not being able to get that car, not having the funds to, get an Uber or to drive for a few hours, or not having someone available to drive you. And so this is a great equalizer when maybe I have to skip the visit, where I can now conveniently have it in my home. So that's another factor where telehealth in general levels the playing field quite a bit in terms
Right.
of cost across the board. Another thing that didn't surprise us was that 98% of older adults prefer telehealth services to their TVs. So that's just intuitive and for the reasons I mentioned. So that was not a surprise. What was a surprise is the comfort that they now have with telehealth in general versus at the beginning of COVID. So this is the fourth year. So we've done 20, 21, 22, and now 23. At the end of 20, which was right at the thick of COVID, if I remember, the percentage was something like 27%. It was very low. And
Right.
now, over 90% are
Yeah.
coming.
Which is amazing. And I think we're also getting into an era, very often we get caught in these perceptions that older adults, balk at technology. And we know, because we've been in this space for a long time, it isn't really a resistance to the technology. It's just a hurdle in learning, because many older adults are not digital natives. I know I'm not. I still can't believe I got through college with no credit card and no computer. I mean, I tell that to my nephews today and they look at me like, how old are you? But we're not digital natives, so we just need a little coaching. We need a little training, maybe, and then we're fine with technology. And I even look at my mom, who's close to 80, and I mean, she texts and she does all kinds of stuff. So I think we're getting into an era too where older adults are much more comfortable with technology and they're looking, to have these advantages for themselves. Let me get into a couple of things that might be seen as more concerns about telehealth. And I'm hoping you can help us get over, some of these hurdles. But privacy issue. I know that for older adults, sharing information in any way digitally is a concern. And is it safe? And, can I trust it? And all that kind of stuff. What would you say in terms of telehealth and privacy?
Well, I know it's conceptual, but really telehealth is no different than going into the doctor's office. So you're not sharing any further digital information. The information they have on you and for you and of you is the same. The only information further is the actual engagement is digital instead of in person. And from that standpoint, it's encrypted, end to end. So it's not out in the open. Nobody can actually pry it open and listen to you. And then finally, the concept of, well, I'm in a doctor's office and I shut the door and I have a private conversation with the doctor. That you can't really get around, but you are in full control of that. So you're in your own home. You could do it in a room that you're private in, or oftentimes people may be living alone anyway. And so, obviously you're also private in your own home. So it's really, if there's such a perception, I think it's going to be, if not long gone already, but on its way out, that the convenience of having the same conversation, the same engagement, you're not sharing any more information as long as you feel comfortable privately around your own space. From the doctor's standpoint, it's the same privacy.
Okay. What about, I came across, there was a study that was done, I think it was the University of Michigan did a study, and this was right on the heels of the pandemic, and it was around telehealth, but it was the perceptions of family caregivers in telehealth, really interesting. And some of the things that came out of that were, well, is my loved one still getting the quality of care they really need? Can the doctor really tell exactly what's going on with my loved one when it's just through a Zoom or a video screen? What if my loved one has, is hard of hearing and it's, maybe a little bit more difficult? What would be your response to some of those concerns?
I think just naturally there would be some legitimate concerns around things that you cannot do as well on the phone or on the TV. You could do things better on the TV because you visually see someone, or just even with video, but then on the TV because you see them better. Let me give you an example. A few months back now, I put this on my LinkedIn account because I went through this example myself. I literally, on a Friday, I ended up having this ridiculously painful toothache. And I had these calls and I couldn't take the calls. It was so bad. And a friend of mine reminded me of this saying where you have three types of pain. You have physical pain, mental pain, and dental pain. So I had the dental
Which is the worst one, probably.
Exactly. So I went through Friday and I said, oh my God, now I have the weekend. And my dentist, by the way, was still back in San Diego. So I'm like, yeah, I think I know a solution. So I actually went on the Independa platform. I actually put my credit card in right on the, conveniently with the QR code. So on my phone, I entered it. And I had this session with a dentist. He happened to be out of Riverside at that moment, and it was after hours Saturday morning. And he was great. He asked a bunch of questions, and he basically thought, and correctly, that I had an infection and gave me antibiotics, sent him right to the pharmacy down the street. and I got the antibiotics, and I was on my way. He gave me pills also. I didn't need them, but so my weekend was from hell to heaven, frankly, right away. And then on Monday, I called my dentist and I said, "What do I do?" She goes, "Well, I would have done the same thing. You don't even need to come in. So just take the antibiotics." So that's a good example of where telehealth and televisits make so much sense. But there are other cases where if somebody, for instance, needs to examine you in a certain way, they can't be done. Maybe they need a stethoscope on you, although I'm sure down the road there's other tools that can be used. Then you have to go in, or if they need to like put something, in your nose, a nostril, or see something. Our friends at Dentulu have a camera that looks like a toothbrush, so you can actually put this camera in your mouth and actually, have the dentist see things as well. So there's a lot of cases where the convenience far outweighs going in, but there are some other cases, like you said, where you need to go in, and I think people generally tend to know which one's which.
And I think, yeah, and I think the tools, like you said, with this dental thing, and I know the cardiologists for a long time now have had the blood pressure cuffs that, they've sent home with their patients and all that. It's gotten so much more sophisticated. And for someone who has spent many, many hours in emergency rooms with loved ones, sitting there waiting for hours, the thought of being able to maybe get something handled in a much shorter period of time is certainly something that I think is a wonderful choice. Kian, it's just great talking to you. Is there anything else we didn't talk about? I know you just got back from CES, a huge, consumer electronics show, and it's always exciting. Anything else you want to share with our audience about what's going on, either with Independa or telehealth or?
I think in general, really, uh, there's a lot more health in the home than maybe when you and I first met. I think
Yeah.
when you and I first met, it was really about how do we take care of older adults the best we
Mhm.
can. And now it's really about how do we stay healthy and well where we want to be. And as you know, uh, it's over 90%. The numbers are actually astounding. 93% of us, when we can go into a senior living community, which we love that market, never consider it. Never consider. So we don't talk about it with anyone. We don't ask for brochures. We don't consider the cost. It's not for us. So 93% are not even in that market. Of the other 7% that do consider it, 4% end up going in. Another 3% don't. So 96% of the older adults that we talk about are actually in the homes, as you well know, and that's where home care comes in. That's where friends and family are in. So what to me is really happening is health has understood it has to be in the home, whether it's hospital readmission penalties, whether it's preventive care, whether you talk about population health, managed care, value-based payments, capitated payments, special need programs, PACE programs. All of these are all about how do I have visibility with you from a distance without cost in a passive way, so I'm not intruding on your privacy and your daily activities. And then how do I catch little things before they become big problems? And so that's
Right.
where we come in. It's a much bigger both opportunity and mission, which is pretty much the same as for older adults, but for all of us. Like there's more than just older adults that had the type of tooth pain that I did. So why not bring health to the home? Why not bring wellness to the home and make things more convenient? And we don't have to be 95 years old to benefit from it. It's just convenient and the right thing to do.
Well, and I love the thought too, because I remember like sometimes with my grandparents, they'd have aches or pains or a dental issue like maybe you have, and just not do anything about it. Just feel like, okay, I've got to wait, or I'm going to wait till it gets really, really bad. Now we have this opportunity to kind of nip it in the bud, like you said, and figure it out, and it makes it really convenient, which I think is really nice. And again, great help for family caregivers who are maybe juggling work and caregiving and taking care of so many things, and all that time that it takes to get involved with the healthcare system in person, and in-person visits and all that can just really become your second full-time job, as we know.
Just
um
Yeah,
yeah.
just one other thought related to that is, and I should emphasize this, I know you live this every day. Social determinants of health, which is sort of the medical moniker for loneliness, isolation, even depression, has shown clinically to lead to self-neglect, to medication neglect, to recidivism in the system, lots of costs and anguish. And all of that is literally preventable. It's not like somewhat preventable if we can make engagement easier, connections easier. So that's been our mission from day one, is to make connections easy. Our tagline is life, connected. And so having the friends and family, making it easy, making it not cost effective, free. So we love, you can extend the mobile app by as many people as you want. There's no extra cost. Again, little Billy's soccer game, or, Jane, when she graduates in Florida and you happen to be in Wisconsin, or, et cetera, et cetera. All these events that maybe you can't be participating in, but now you're participating in them. So that really changes the quality of life, and also leads to better health. And nowadays there's a concept of healthy days, and really healthy days are just another way to measure, whether you're isolated or not, whether you're happy or not, whether you're well or not. And again, it's all around sort of doing the right games and the right social engagement and the right sort of reminders and friends that can connect with you easier than in the past.
You're absolutely right. Those connections are vital, right? We are social animals, and when we lack that connection, we don't thrive. We don't do as well as we could. Remind me before we go. Now, I know during the pandemic, for those who are Medicare eligible, so over the age of 65, that CMS was reimbursing and paying for the telehealth visits. Has that continued, Kian? Are they covering those costs of telehealth visits, or?
I'm not sure, because so much of it is also state by state.
Okay.
I read one of the states, I forget which one it was, that said the televisits are covered and doctors get paid for 6 months after the end of COVID, which
Okay.
whatever that is.
Yeah, officially, what was that date, right? Well, so it's just something for our audience to know, is that there might be a slight cost with some of the televisits, but again, it's a very affordable. When you think about the time spent, the gas, to get there, the parking fees, all the things that are involved with doctor's visits, you take a look at,
Okay, so when we think about the uninsured, the underinsured, and the copay, a doctor visit is $55. And you pay once with your credit card, like I said, with a QR code, very convenient with a tablet or a phone. And then our partners then have your credit card. So next time you come, you don't have to even enter that. We also make it convenient for you to actually engage with them. And then from there on in, we just ask you, do you want to pay $55 for this visit? And you say yes. And then the schedule happens. So you don't have to go schedule. You don't have to wait, for 2 weeks. So there's a lot of convenience and benefits to it. But like you said, it's for second opinions. It's for when you can't drive, when you don't want to drive, when it's too dangerous to drive, when maybe the car keys are taken away, or, so many different situations that it could be very helpful.
Absolutely. Well, Kian, we could just talk all day, but I really appreciate the time for you to share all of this great news with us and your wonderful survey that you do every year. Where can our listeners find out more about Independa?
Well, the easiest, best way is to go to independa.com. That's INDEPENDA.com. And you can register for the Health Hub for free and benefit from that. So we love that. And you can use it, all the things that are free, and never use any of the services that we have through our partners. And we're all happy about that, because it brings you social engagement to the home.
Well, again, Kian, thank you so much for being on our episode, and we really appreciate all your insights, and good luck with everything.
Such a pleasure, Sherri. It's great seeing you.
So wasn't that great information from Kian? What he's done is so brilliant, and some of these age tech solutions and innovations that are out there, we don't really know them. So it's why I like to bring a lot of these great entrepreneurs and their ideas and their companies and products and services to you, because, unless you're searching for something specific, it's sometimes hard to find them. But anyway, Independa and Kian have just done such great work. So I was really thrilled to have them on. Now, the whole point of that discussion was talking about how do we keep our loved ones safe at home, but also keep them socially engaged and connected. And technology is a great help with that. But that also brings us into our Well Home Design news, which is that we have National Moving Month and also National Home Improvement Month, all being celebrated in May. So I'm going to start with the home improvement first. I want to talk a little bit about, there's a chapter in my book called Peter Pan housing. And the reason why we call it that was actually a phrase, by the way, that was coined by my professor when I was getting my master's in gerontology. He was kind of the person who came up with that phrasing and did a lot of work in, home improvement and modification for older adults. But we call it Peter Pan housing because it's basically describing homes that were built for people who will never grow old. So among the inventory of homes in the US, and there's about 100 million homes in the US, only 1% of them have what we call universal design features. Now, universal design is intended to be ageless. So whether you're 8 or 80, you can open a drawer, you can open a door, you can get in the shower without falling, you can do all these things. And that's really the concept about universal design. And it's really the foundation of what we talk about when we think about home modifications for older adults. It's really based around safety, of course, accessibility, being able to get to things, adaptability, so making things, adaptable, and usable and all of those things. So that's really the core foundation, and that's really important. But on top of that, there are other things now that I think are equally as important. And so one of the things that I'm doing, and I loved it because I created the Snug Home blog before the pandemic, which was really focused around this concept of well home design. So not just universal design and ageless design, but also wellness in the home, right? And so using the well building standards and also using biophilic design principles, which is bringing, the outside in, bringing nature in. I've kind of, meshed this all together with universal design, and I've come up with my well home design checklist, and I'm starting to work with interior designers and real estate agents and builders and others on this so that we create these homes that aren't Peter Pan homes, but are homes that will accommodate us as we age, but they're gorgeous. They're not the sad grab bars of, the past that we think about. First of all, the designers that are doing these things and companies like Kohler and Pottery Barn and all these different, manufacturers and folks, and even, like Sherwin-Williams with paints, which have bacteria and odor resistant paints. Everyone's thinking about more wellness and ageless and bringing that into the things that they're creating and bringing forward. So it's a very exciting time to be doing all of this. But I'm going to have an article that I'll have a link to on the episode guide page. I'm not going to go into it now and take up all your time listening to me talking about this, but a lot of it is built around what I call the 5 C's. And the 5 C's in age-friendly design and even dementia-friendly design, because I have a whole webinar, by the way, I'll also include that link, but that's a free webinar offered to you guys on my YouTube channel. Because most of the time when I'm doing these webinars, people are paying me to come in and help educate, whether it's family caregivers or employees or their workforce or whatever it is. But this one is a free one, the Dementia Friendly Design. The 5 basic C's that we want to think about are curves. Too many pointy, sharp edges, whether it's tables or counters or chairs or whatever it is, are bad, of course, for young kids. They're also bad as we get older because we can bruise ourselves, tear our skin. So the curve is really important. And the curve also plays into our brain health because the curve is how our brains thrive. We love curves. We don't really love grid lines. We don't like those kind of, what would you call it, 90-degree angles everywhere. So it's something that you'll read about in the article, and you certainly read a lot more about it in my book. Contrast. So again, as our eyes age, we don't see certain colors as well. We need to have a lot of contrast between like the counter and the cabinet, or the steps on the stairs. The tread and the rise need to be a very different type of color or type of material or something. Color. Now, this is where color psychology really comes in. I know I've mentioned this to you all before. Again, you're going to read it in the article that I'll have the link to, and as well as in my book. There's a whole chapter on color psychology. Green is the most optimistic color as we age. And again, because green means nature, thriving, living, right? That makes sense. But also green, in terms of the color spectrum, sits right in the middle. So it's not, on one end or the other end, it's right in the middle. And so that is the color that we see the longest, even if our vision is failing. So it not only brings about kind of optimistic, again, positive feelings that we were talking about earlier with anxiety, but it also is the color that we see the easiest. So greens become really important. But other colors as well are just as great. And I talk a lot about color psychology and what those all mean. And we use, by the way, we also use a lot of color design in dementia friendly design. You'll see that in the webinar. Why, for instance, we use red or blue plates to serve meals instead of white plates. Clutter free. This is a perfect one for brain health again, because we're used to having wide open spaces where there's no predators hiding behind something. So if you have a lot of piles of magazines or just too much stuff that's cluttering up not only your walkways, which could become trip hazards, right? But also just cluttering up your brain. There's just too much to take in. We really need to try to simplify and again, try to open the space up, because that's going to take away that anxiety. Sometimes we don't even realize how much our environments have to do with anxiety that we might be feeling or our older loved ones might be feeling. So clutter-free becomes really important. And comfort sources, those are things that just make us happy. Being able to visually see those, not having them wrapped up in the box in the attic, but getting things out that mean something to you. And if it doesn't really mean that much, then downsizing, getting rid of it. But there's a lot of details that go into home modification. And again, I'll have some articles, but if you pick up my book, you're going to have whole chapters dedicated to this biophilic design concept. Bringing nature in is so key, so critical. So there's a lot of really good information in there for you as a family caregiver of somebody who is older. Now, resources for you on home modification. Very often they're called, there's different certifications. So different organizations will have a training that people have to go through to get a certification. Probably the biggest and most well-known is what we call CAPS, which is Certified Aging in Place Specialist. That's through the National Association of Home Builders. And again, it's a training that whether you're an architect or an interior designer or even real estate agent or a builder, you go through this training so you truly understand aging in place and universal design. So it goes above and beyond ADA. Some people say, oh yeah, I understand ADA, but this is a whole level above. And by the way, you really need to get somebody who knows this stuff, because if you just get a regular handyman and you're thinking, okay, yeah, I'm going to put some grab bars in, for my dad in the shower, whatever, they may not know how to ground them properly. They may not get the right type of grab bar that can withstand if somebody is, grabbing it because they're falling, it's going to not come out of the wall, right? So there's a lot of nuance to this, and I want to make sure that you understand this isn't just like anybody can go do this. You really have to be trained in how these things work. But CAPS professionals, Rebuilding Together is a great resource because they're a nonprofit that will come in and help make some small modifications in the home. Habitat for Humanity, by the way, has just added a new group called the Aging in Place program. As you know, they go out and build homes in different places for people who are underserved. Well, now what they're doing is they're addressing the older population who needs their homes modified. So they have a whole group now doing that, which is really exciting. There's also some companies you can tap into. So the Porch Group is one that I know. They'll do home modification, but they'll also do moving, which we're going to talk about in a minute. And then Angie, of course. Angie is used to be the Angie's List, right? And they absorbed and bought Home Advisor. And so that's all now under the Angie umbrella. And they, of course, you can find handyman, repairs, whatever. But again, when you go on to Angie, search for universal design. ADA is your secondary backup for searching, but I do think they have universal design folks that are listed, and you want to make sure you get one of those experts in your area. Now, for those of you who know me, my friends are going to laugh when they hear this, but I'm obsessed with HGTV. And in fact, I've been in talks with some of the executives at HGTV about different things around home design and some other stuff. But I just want to do a shout out because HGTV had a new show that debuted this season, and it was called Renovation Aloha, and it was with Tristan and Kamahai in Hawaii. So cute. They're adorable couple, but oh my goodness. And HGTV, even though it's kind of the same thing, I love every single show that they have. But anyway, what I wanted to do the shout out about is not only do Tristan and Kamahai come in and they renovate these homes that are just destroyed, and they bring them back to life and make them so, so beautiful. And then, of course, you've got the landscape of Hawaii. Who wouldn't want to live in paradise, right? But what I really love about this show, which is now my number one favorite show, I still love Hometown, and I still love The Mars and Fixer to Fabulous. And Dave Mars is, love him. I mean, man who can work with his hands, and the woodworking he does is just beyond amazing. But anyway, going back to Renovation Aloha, what I love is the family connection. In Hawaii, there is a culture of intergenerational living. And it's where we have multi-generations who live in the same home. The grandparents are very involved with the grandchildren. We know that this will help us live longer. Since it's Older Americans Month, let's talk about that. And it helps your kids with anxiety. It helps your kids with resiliency. It is pretty amazing when you bring these generations together. So I love the fact that this show celebrates that. They always bring their family and friends in when they finish a renovation. And then they have Kamahai's dad does a blessing, which is part of the Hawaiian culture, which I just love. I wish my house had been blessed. I need to go do that. But it's just really beautiful. And I think it's a great reminder to us that family is super important, and the honoring of their family, their older adults in their family, is just really beautiful. So my favorite number one show, and so excited because they just got picked up for season 2. So that's my HGTV obsession and commercial for today. Also wanted to do a shout out to Rosemary Rossetti, who was on our season 2, episode 15 podcast episode. If you're interested in universal design, she is the guru. Go and check that episode out because she's got really wonderful things. And she actually created the Universal Design Living Lab, which is her home. So you can check it out. We've got photos and everything for that. And that was a really great interview. And then I mentioned May is National Moving Month. So again, I'll just give you some really great resources. But one of the things that we know that happens to us as family caregivers is, whether our loved ones decide that they want to move to a senior living community or just downsize because they can't manage the garden, the pool, the home, whatever it is, they just can't manage all of these things anymore. Or if they have to move into something, let's say like memory care, and you need to then sell the home, and there's a lot of stuff in the home that needs to be sold. There are a lot of really great resources out there. We interviewed Matt Paxton, who we talked about clutter and stuff, but his book, which is really wonderful, I'll have a link on the episode guide page. He has a lot of really, really great resources for this, but I wanted to give you just a couple. So Caring Transitions will help you both move, but also downsize. So they'll take care of that. Moves for Seniors is another resource, again, for moving and downsizing. And then there's EBTH, which used to be an HGTV show, but it stands for Everything But the House. And this is really where they come in. Let's just say you've lost your loved one and you just don't want to go through the whole house yourself. They will come in with experts. Now, they will ask you, do you want to keep this? What are we looking for that maybe you want to keep? But then everything else gets marked and tagged, and they do an online auction and they sell these things. So the treasures that don't really mean anything to the family anymore get sold on auction across the country. So those are some really great resources for you to think about, but there's many others out there. And again, we'll have all these links on our episode guide page. So now I want to go to our Me Time Monday Wellness Hack. And as I promised, May also is when we have National Day of Prayer. It was on May 2nd this year. And even though spiritual wellness is not just about faith and prayer, there is certainly a sense of believing in a higher power. But there's also other things that we can do to build our spiritual wellness. And I wanted to share these little hacks with you because a lot of times we don't pay attention to our spiritual wellness. And it's the one area of the 7 elements of wellness I talk about in my book that gets, short shrift. We're not paying as much attention. So here's some great hacks to think about. It'll not only help your anxiety and your emotional health, but it also, again, will boost your spiritual health and your spiritual wellness. So here we are with our Me Time Monday Wellness Hack. Welcome to our Me Time Monday Wellness Hack. This episode, we focus on spiritual wellness, one of the 7 elements of wellness from my book, Me Time Monday. A recent Pew Research survey on religious affiliation showed 1/3 of Americans describe themselves as atheist, agnostic, or nothing in particular. However, 90% of those surveyed considered themselves spiritual, or SBNR, which means spiritual but not religious. How do religion and spirituality differ? In most religions, there are rules and rituals such as going to church, synagogue, or the mosque on certain days, fasting at certain times of the year, or preparing food in a specific way. There are also other rituals such as communion for Catholics, bar mitzvahs in Judaism, or Muslims praying 5 times a day facing Mecca. Other people feel they have spirituality in their life, believe in a higher power than themselves, but practice an eclectic mix of mystical or unorthodox philosophies and theologies. When you live a life where there is no higher power than yourself, you not only put tremendous and unrealistic pressure on your emotional health, you emphasize your sense of isolation and aloneness. This is not what your ancient brain is seeking. Many millennia ago, being cast out of your tribe meant despair and ultimately death. In this increasingly secular world, we are replacing a higher power with high tech. This is making us less happy and more isolated. It fuels emotional despair, anxiety, and depression because we are constantly connected to negative messaging, bullying, and, let's face it, insipid lifestyles of the narcissist nation, while we've lost our connection to God and to spirituality. You can also experience internal guilt when you violate or ignore your deepest values and your spirituality. Arthur Brooks, a Harvard professor who writes and speaks on happiness, said 30% of how religious you are is based on genetics and your upbringing. The rest is faith. By turning your back on your spirituality, you abandon your faith in yourself and in the future. One way to build spiritual wellness and awareness is by taking a labyrinth walk. A labyrinth is different from a maze because it has one start and one end point, whereas mazes have options on which path to choose that can often overwhelm your brain, causing confusion and anxiety. During a labyrinth walk, most of which are done outdoors in nature, you are paying attention to your breathing, listening to nature sounds, and thinking about your inner life, the challenges, the reason for being, the relationships that nurture you or hold you back from fulfilling your meaning in life. It is a contemplative exercise that many call meditation in motion. It is a great alternative to breathing exercises or traditional meditation that can be difficult for some people. By being able to move and think about your emotions and feelings without other distractions, you feel a sense of spiritual awakening and wonder. Many people who have done a labyrinth walk talk about feeling more grounded, more calm, and more accepting of who they are and why they are here in the world. In my first book, I was inspired by research on the indigenous people in Australia's outback and how a special ritual resembled the journey that family caregivers take. Here is that story from my first book called The Caregiver Walkabout from a Cast of Caregivers. There is a cultural tradition among Australian Aborigines that very closely resembles the journey caregivers take. It is called a walkabout, and it is a rite of passage for adolescent boys to become men. These young boys have no choice on whether they want to do this or not. It is a long-held tradition these people believe connects them to the land they love. They are sent out alone into the outback, sometimes spending months in solitude. Many of the boys follow ancient songlines or dreaming tracks where they learn to find food and shelter, the same types of food and rock formations their ancestors found before them. During this quest, they develop a deep sense of self-awareness, and when they return to their families, they have a greater sense of who they are, their importance to their family, and their heritage. In many ways, caregivers are on a walkabout. You may feel you had no choice to become a caregiver. You may spend months or years feeling all alone in your caregiving journey. But along the way, you learn about food and shelter and legal paperwork and insurance rules in the care of your aging or ill loved one. When you return from your caregiving journey, Hopefully, you will feel a sense of connectedness to your past and to your future. In this journey called life, you understand your purpose, your role. And while you may have felt alone in the caregiving outback, friends, experts, and others were helping to guide you. They were in the stars and the whispers of the wind at night. When you open your eyes and realize you are or will be a caregiver, you will know you are not alone. Welcome to the cast of caregivers. The wonder of dragonflies. Approximately 300 million years ago, long before dinosaurs roamed the earth, one of the first organisms to inhabit the planet were dragonflies. In China, people associate the dragonfly with prosperity, harmony, and good luck, while among Native Americans, dragonflies are a sign of happiness, speed, and purity. In Japan, dragonflies are a national emblem and are seen as symbols of happiness, strength, and courage, with ancient Japanese samurai using dragonflies on their mon, known as heraldic crest, to symbolize victory. While the myths and symbolism of dragonflies varies, many Western cultures still feel dragonflies are signs of mischief. Most agree dragonflies are mysterious insects, offer poetic insights when it comes to caregiving and wellness. Let's take a look. First, dragonflies have perfect agility, with the ability to not only fly backwards, but have each wing work independently, giving them unparalleled aerodynamics to fly sideways, straight, up or down, or just hover in one spot like a helicopter. This adaptability and flexibility is a message for caregivers who accept change. Second, dragonflies can see more than most living things. Their heads are 90% eyes, and they have almost 360-degree vision, with just one blind spot directly behind them. The ability to be present and to be realistic about what you see is key for caregivers. And understanding you may have a blind spot when it comes to your loved one lets you be realistic about striking the balance and caring for your loved one as much as caring for yourself. Third, dragonflies are cold-blooded, which means they have difficulty regulating their body temperature, whereas warm-blooded humans have no such trouble. To address this, dragonflies will assume the obelisk posture, similar to a handstand-like position in yoga. This helps them prevent overheating on sunny days. For caregivers, this is a reminder to take time to raise your face to the sun or practice a little yoga. Fourth and last, dragonflies are seen as magical, beautiful creatures, mostly because of the iridescent hue on their body and gossamer wings. Dragonflies spend most of their life underwater until their metamorphosis into brilliant flying creatures we see. Some believe it is this lengthy incubation in salt water that gives dragonflies their beautiful iridescence, a word derived in part from the Greek word iridos, meaning rainbow. In this context, the dragonfly becomes the perfect symbol for the Me Time Monday program. It is about light and water, two things that draw you into nature and wellness. It is also a reminder to caregivers to live life colorfully and to embrace caregiving as a dragonfly embodies change, transformation, adaptability, and self-care. Spirituality also allows you to experience awe, a sense of wonder that is often something experienced solo. Awe is a unique blend of curiosity and uncertainty. While this would seem to create anxiety, instead, it fills your soul with spirituality. Awe factor of watching the northern lights, or a shooting star, or just staring at the galaxy with hundreds of stars that you can see at night, reminds you of how small you are and how your daily struggles are part of a larger story being written across the universe and across time. Learning about your ancestry gives you a perspective on life's challenges and fears. Contemplating your role in the universe does the same thing. A 2021 study found experiencing moments of awe on a daily basis reduced stress levels and increased self-reported feelings of life satisfaction. Other research stated feeling awe can lower inflammatory cytokines that are created in response to the body's invaders. They mobilize immune cells to fight the pathogens such as viruses or flus. While studies show 75% of our sense of awe comes from nature, the sensation of having your breath taken away or staring in wonderment can be a nature scene such as a sunset, a snowy mountaintop, or the magic of fireflies at night. But it can also be watching a loved one sleep soundly, contemplating a beautiful work of art or architecture, witnessing a child's birth, or holding the hand of a loved one as they take their last breath. Some psychologists call this sunset mode, a term that defines a mindset allowing you to take all of life's emotions in, but realize the moment will not last. In our world of scientific certainties, we are surprisingly okay with experiencing the mystery of awe. This is because when you encounter awe, you also experience faith, and faith replaces fear in your soul. We hope you enjoyed this Me Time Monday Wellness Hack. Each episode of our Caregiving Club On Air podcast features a new Me Time Monday Wellness Hack. You can find these and more in my book, Me Time Monday, the weekly wellness plan to find balance and joy for a busy life. And you can visit MeTimeMonday.com or CaregivingClub.com for more information. We hope you enjoyed this episode of Caregiving Club On Air. Please hit the subscribe button to listen to us on our newest channels, Amazon Music, SiriusXM, iHeartRadio, Pandora, as well as Spotify, Apple, and Google Podcasts and other listening channels. Check out all the resources and article links on our episode guide page at caregivingclub.com. Just hit the podcast tab at the top. Email us with comments and questions at podcast@caregivingclub.com. Thank you again for listening. Take care and stay well.